comprehensive primary care CPC initiative worked to improve care, improve health, and lower costs for patients and their families in the primary care setting. Nearly 500 primary care practices and more than 2,000 practitioners were enrolled in CPC from 2012 to 2016. The CPC initiative focused on 5 functions of primary care: access and continuity, planned care and population health, risk-stratified care management, patient and caregiver engagement, and coordination of care across a medical neighborhood. This on-demand learning series explores how CPC practices implemented strategies designed to strengthen primary care.
So our Patient Advisory Council started about 3 years ago now with the development of CPC and our participation in that program. And when it first started, we really struggled to know what we were going to do with our patients' feedback, but really powered through, and I'm so thankful that we did. We have a current setup of about 7 members, and sometimes that fluctuates to 6 to 8 depending on attendance. And right around the 2-year mark of our Patient Advisory Council, we started to recruit some new members just for some fresh ideas and for some new feedback. And we kept a couple of those patients that were on our original council just to make sure that we had a really diverse group of individuals to represent our very diverse patient population. So we have 3 who are young parents. Some of them are patients here themselves, and some of them are parents of our pediatric patients. We felt that that voice was really important since it's the population that we have that we serve here. We have a gentleman who is in his 60s, and he retired a little while ago. And then 3 other individuals who represent more of our internal medicine clinic. We have a very ethnically and socioeconomically diverse group, which is indicative of the area that we serve. And so it was really purposeful when we were looking for patients that we had a group that really met all of our demographics here. Originally, we had started working with our Patient Advisory Council on different workflows and different signage that we wanted in the clinic. And the Patient Advisory Council was happy to do that, but they really wanted to do more. And so we started looking at patient education and how we do that outreach here in our clinic, because they felt like it was very important to make sure that there is a patient voice when we're performing outreach. And we really agreed that when we're doing outreach, we need to make sure that the patients feel that it's in a way that's meaningful to them. Some of the longer term things that we've been working on have been patient satisfaction and this patient education piece. So one of the things that we found is that they did not like the glossy, generic materials that we all have in our exam rooms where we hand a patient sort of a trifold information about different pieces. But they wanted something that looked a little bit more homemade, very personal, something that would catch their eye when they were in the waiting room. And so they helped create some ideas and some of our outreach that we did to couple with those ideas. The Clinic Quality Committee is something that I am so proud of, and I'm so thankful that we have so many engaged caregivers here. So this idea came out of our Patient Advisory Council wanting to work on our patient education regarding quality. So this committee was created to produce the work that the Patient Advisory Council was looking for. So it's made up of physicians and medical assistants and physician assistants and receptionists, and then the leadership team. We meet once a month, and we meet 1 week after the Patient Advisory Council meeting, and we take the ideas and the things that they want to see, and we create them into educational posters. And then these educational posters are reviewed by our Patient Advisory Council to make sure that from a patient's perspective, the education we're providing makes sense, is at a level that's easy to understand, and really speaks to them. So we've been doing this it'll be 2 years in December, so about 1.5 years. And every month we do a different topic, and we try to couple those with whatever the national healthcare awareness is. So if it's November, then it's men's health, and trying to make sure that we're hearing it from different perspectives for our patients, but in a different way. So we'll show you a couple of examples of what this looks like. So this is our November. Every man is someone to somebody in your provider's care. So each of these pictures are our providers, and they're wearing a mustache that we got from just a little Party City store. And then every mustache that's in green has a fact about men's health. And from our patient advisory council's perspective, most of them are married or have some men in their life that are a little disengaged in their health care. They're just not really excited about going to the doctor and following up. And so they really wanted it to be, you know, as a man, you're someone to somebody, and somebody cares about your health. And so your providers care as well. So this was our November poster, and we had this up in our lobby where our patients wait in line. So it's something to engage them while they're waiting to check in for their appointment. And it's something that caused quite a bit of stir because it was really fun to go and look and say, like, oh, that's my provider, and look at her in the mustache, and that's so funny. And one of our providers was actually pregnant at the time, and she put a little mustache on her belly as well, so it was just a little fun. So a lot of our patients have been really excited to see these posters, and every month when we do a new one, we always get new feedback, and they actually facilitate quite a bit of conversation in the exam room because they're waiting in line, seeing this poster, and then it sparks some conversation in the exam room about that topic. So the Don't Puff Your Life Away, on the top of each of those cigarettes is an educational fact about smoking. And then also on the side of this, we had some brochures about smoking cessation and talking to your provider about that. This is one of our most popular quality committee boards. We have had more comments about this than we have any other board we've done, with the exception of the sugar board. So this is some of the data that we present to our Patient Advisory Council. This is our 3 cancer screenings that are rolled into one. So colon cancer, cervical cancer, and breast cancer. And you can see from March of last year through February of this year, the letters at the bottom are the months of the year, and just the incredible improvement. And some of these numbers are really hard to move, and I feel like a lot of this impact has just been continuous, and it's not that one month is the focus and then it diminishes. What's been really enlightening for me is that it's engaged our employees so much, and that they feel more empowered with patient quality and making sure the patient voice is heard, and that's been really helpful. So I think overall we talked about, our Patient Advisory Council and how much they do for us, and I feel like they have just been really engaged in this process. And a couple of the members who started out the group are still coming here to our practice, and they continually say, that was just so enriching for me to participate, and I feel like I made a difference in some other people's lives, and I'm just really proud to have been a part of this. And that's been really encouraging for me, and I feel like really focusing on that patient voice and giving them the power to make some of these decisions has been so enriching.
For more information and resources, visit the Comprehensive Primary Care Initiative webpage. Go to innovation.cms.gov and search for the CPC Innovation Model. This has been a production of TMF Health Quality Institute.